Hi, I'm Dr. Ira Simon. You've found this video because you're trying to figure out what's wrong with you actually. You're searching words such as gum disease, swollen gums, bad breath, pus, loose teeth. Whatever it is you've entered into Google or any other search engine, it's brought you to this video today. So, welcome. I'm a periodontist, a dental specialist that deals with diseases that affect the supporting structures of the teeth. The first type of disease that affects our gums is known as gingivitis. Very, very simple. Gingivitis, inflammation of the gums. Many people have it, young adults, children, even adults, older adults have gingivitis. This type of infection just affects the gums. It doesn't affect the bone. There's another type of infection that occurs following gingivitis in many patients known as periodontitis. Periodontitis is an infection that's going to affect the supporting structures of your teeth, the bone. You can have the most beautiful smile in the world. You can never, maybe it's possible that you've never even had one cavity. You can go throughout your entire life without even having a cavity, but if you have periodontal disease, periodontitis, you can lose all of your teeth in time. So the most important thing you need to understand is what the disease is and how you treat it. Well, the disease is a chronic infection. There's bacteria that live in and around the pockets that surround your teeth. Bacteria find places to live. They live in these reservoirs around your teeth, inside the gums, these pockets that the dentists call them. In these pockets, bacteria can live. There are places that are wonderful, warm places with very little oxygen that bacteria love. It's a wonderful place to be for a bacteria. But in time, the normal type of bacteria that exist in these spaces can become bad bugs. They can become pathogens. These bacteria known as pathogens are not friendly. And your immune system, whose job is to constantly scan your body, is looking at yourself all the time. And it's looking for things that are invading that can potentially cause trouble. Well, your immune system may start to react to these bad bugs, to these bacteria, to these pathogens, and when your immune system reacts to these bad bugs, it starts to destroy the bone that holds your teeth in place. So in time, you develop a condition known as periodontitis, or an inflammation of the supporting structures of your teeth. What does it mean? Bottom line, it means bone loss. The bad thing about periodontal disease and the good thing about periodontal disease is typically it doesn't hurt. But unfortunately, pain is not always a bad thing, because pain usually makes a patient go for care. But in this case, because it doesn't hurt, you can go for years without treatment. But just because you don't have pain doesn't mean you are not experiencing bone loss. The most important thing for you to do is to get an exam. Please, by all means, go see your general dentist, or if you'd like, come and see a periodontist. The first thing we're going to do is we're going to examine your gums. We're going to check the pockets around your teeth. Are they 2s and 3s? Are they shallow, or are they deep? Are they 5s, 6s, 7s, 8s, 9s? How deep are they? The numbers are measurement in millimeters. You can have anything from a 1 or a 2, even up to a 12. If you have deep pockets that are 12s, most likely you're out of luck. You're going to lose your teeth. But if you have pockets that are 5s or 6s or 7s, your condition is pretty treatable. You can receive treatment. Treatment is easy. It's effective. Typically what it means is removal of the bacterial tartar from the roots of your teeth. The way we do this initially is through a deep cleaning. What is a deep cleaning? It's something that is called scaling and root planing. It's the same thing. What we do is we try to remove the bacterial tartar from the roots of your teeth without doing any surgery initially. It's a very conservative procedure where we try to remove the tartar from the roots of your teeth so that your immune system doesn't continue to destroy the bone around your teeth. After we do the deep cleaning, we go through oral hygiene with you. We explain things to you so you can take good care of your teeth, remove the bacterial plaque on a daily basis through flossing and brushing, maybe even using little brushes called proxy brushes, and we'll talk about that on future videos dealing with oral hygiene. However, after the deep cleaning is done, we look at you about a month later, we re-examine your case, and we see how effective the deep cleaning has been. In many cases, all you'll need is a deep cleaning, and you can then enter into our hygiene program where you get your teeth cleaned every 3 months. Why 3 months? Because it takes 3 months to go from a healthy, normal bacteria to a disease-causing bacteria. It's this disease-causing bacteria that your immune system is going to react negatively to and destroy the bone. So first we have the deep cleaning, then we have a reevaluation appointment. If the pocket depths are still deep and your gums are still bleeding, then it's time potentially to talk about another procedure. This other procedure involves a simple surgical procedure where your gums are gently moved away from the roots of your teeth and the rest of the tartar is removed. What's important for a patient is to understand is if you have pockets that are 4 millimeters, you're in luck. We're very good at cleaning 4 millimeter pocket depths. But if you have pocket depths around your teeth that are 5 or 6 or 7 millimeters, the best clinicians are going to leave behind 50% or more of the tartar. So even with the best intentions, it's highly likely that the best clinicians, even though they have the best intentions during the deep cleaning, are going to leave a lot of the tartar behind. If we leave the tartar behind, your body's going to continue to destroy the bone. So, first step, get the exam. Come in, please. Second step, have a deep cleaning done if it's appropriate. Then we'll reevaluate your case and we'll see how well you did. If you've done fine and everything looks good at this next visit, you're welcome to join our hygiene department and see our hygienist on a regular basis. If we're concerned that the infection is still progressing, well then it's time to think about surgery to be able to treat your disease. The most important thing we can do for you in the most comfortable way possible is to help you save your teeth. We're here to inform you. We're here to treat you in the most gentle way possible. We have many different ways to keep you comfortable in our office. Most patients just require local anesthetic, and they're very comfortable. If you're anxious about the procedures, there's many different ways where sedation can be delivered so that you're comfortable during the procedures. Our main goal is to make you comfortable, to make you aware of your disease, and deliver the appropriate therapy for you so that you can continue to keep your teeth. Any source of infection is bad for you. It could potentially be bad for your heart. If you're diabetic, an infection in your mouth can make it more difficult to control your blood sugar. There are many reasons why you should seek gum therapy. The most important reason is your overall health and maintaining the function of your dentition throughout your lifetime. If you need more information, please visit our website, irasimondds.com. We have 2 wonderful offices in Marin County, one in Novato and one in Corte Madera. If we could be of help to you, please give us a call. Thank you very much.